Bariatric surgery or weight loss surgery is becoming an increasingly popular and accessible option for people experiencing chronic obesity states. And with this increasing popularity of bariatric surgery, both here at home in Australia and abroad via medical tourism, what is becoming more apparent is the increasing numbers of clients reporting post-operative regain, lack of post-surgical support, and lack of guidance within the scope of their nutritional needs and outcomes. And this is triggering the ongoing investigation into surgical revision under the idea that the initial surgery didn't work. Now, in the majority of cases, and a little known fact, this has nothing to do with the surgery itself. However, more to do with the preoperative and postoperative education, counselling, and food behaviour management, coupled with a need for appropriate bariatric specific balanced nutrition monitoring and guidance for up to 24 months after surgery. This is something that's not wholly offered to the bariatric community as a complete treatment approach. And I'd like to say it's especially true for those who travel abroad to have their surgery at lower cost, but that's not the case either, with this being across the board with surgeries here in Australia and globally. Now, many of my post-surgical clients, when they first visit me, report post-operative regain upwards of 50 to 70% of their original loss. And this is fueling their personal investigation into surgical revision, often stating that they feel that they should have had more adequate education and support before and after surgery. And if they did, they would have experienced better outcomes. And you know what? They are 100% correct. For many years, I've mentored, coached, and guided bariatric clients through the behavioural aspects of the food relationship before and after surgery. And as a clinical nutritionist, food behaviour counsellor, NLP practitioner trainer, and psychotherapist with personal and professional knowledge of the post-surgical bariatric lifestyle, I have dedicated my clinical practice to investigating the needs of the bariatric client, formulating a treatment approach that provides clarity around bariatric health impacts and how we, as complementary medicine and natural health practitioners, can deliver the care and support that this ever-growing client population needs, as opposed to the en masse generalized guidelines that are currently in effect. Now, there are so many aspects to the post-operative diet and mindset that need to be addressed. And I can tell you firsthand that only a small percentage of these are covered in the contemporary surgical experience. By taking the approach of addressing food behaviours, education, and psychology as the primary focus, and secondarily supporting the client with individualised nutritional guidelines and education, which are specific to the bariatric physiology, I have successfully aided hundreds and hundreds of clients to not only establish balanced nutritional intakes that promote post-operative weight loss, but also minimise hair loss, address nutritional deficiency states, and support existing comorbid conditions such as GERD, hypothyroidism, hypertension, diabetes, autoimmune conditions, and also improve gastric motility by improving enzymatic response and reaction. However, most notably, I've helped clients address post-operative regain by improving pouch and sleeve satiety points, so re-establishing feelings of post-surgical restriction after periods of overconsumption and overindulgence. And I help maintain this focus by addressing food relationships, assisting clients to achieve goal weights and avoid those revision surgeries, which can be ever so detrimental to their ongoing health. Ideally, for the best surgical outcomes, the client should receive the tools for their success before and after surgery. It means having the right network of professionals to support them on their journey and guide their outcomes through education to their desired goal. It means helping clients understanding that health and well-being do not just fall into place as a side effect of weight loss surgery, but rather that a new approach and a new foundation is required to achieve these goals because all the parameters are different now. So that's why I've developed this training program. It's the Natural Health Practitioner's Guide to Treating the Bariatric Client. It considers and manages health outcomes in clients before and after weight loss surgery. After working specifically with bariatric clients in the field of clinical nutrition and food behaviour counselling for close to 10 years, it's becoming ever apparent to me that there is this growing need for more skilled and dynamic practitioners in the natural health and complementary medicine space. And this gap needs to be filled now. Current education has only begun to scratch the surface in terms of bariatric needs within the formal education space, generally only made available to those just embarking on their natural health and complementary medicine journeys. And in saying that, the units that are delivered with the bariatric specific education only dedicated a few short hours to such a complex and variable consideration. But it doesn't offer an avenue for seasoned and established practitioners to upskill and meet the needs of this ever-growing client base. So that's why I have developed this course. So this intensive course has been designed for natural health practitioners to bridge that knowledge gap between current practice and its application in the bariatric client. And in this course, what practitioners will expect to learn is an overview and an introduction to the bariatric client, the surgical overviews, what to expect, anatomical changes, comorbidity and the influence on obesity, pathophysiology and the pre and post-operative considerations and health emergencies that arise, dietary protocols for pre-operative and post-operative outcomes, vital tracking information, bariatric eating protocols and dietary phases for that first 24 months, addressing malabsorption, nutritional needs, bioavailability, and anatomical and metabolic change. Practitioners will also expect to learn psychological eating practices that are very common with the bariatric presentation, supporting the bariatric client and successfully promoting their varied levels of nutritional literacy, emotional and disordered eating, and food behaviors and food relationships. They'll also get useful tools and resources to help clients navigate and reverse post-operative regain using my successful mind-body-belly system and techniques, my proprietary Begin Again dietary protocol. Now, I just want to put this in perspective for you. A unit in a bachelor's degree will generally consist of approximately 12 contact teaching hours. And this course will be delivered at the same tertiary level. However, there are differences. So I'll explain this to you. In a normal or an average university course unit, there'll be 12 contact hours over 12 weeks. And for instance, in a nutritional unit, approximately 4 of those hours would be dedicated to bariatric nutrition at a cost of approximately $4,500 for that unit. There'd be no textbook provided, no ongoing support, no dedicated group for ongoing learning, and no practical resources to provide to your clients once you have the know-how. But this course has over 14 hours of in-depth interactive contact, which you can gain CPE for. It's dedicated and niche specific. You will get a textbook provided for you that I have lovingly created for the bariatric client to be served in the way that they should. You'll get ongoing support to consolidate learning. So if there's anything that doesn't quite fit, let's discuss. There'll be a dedicated alumni group for ongoing learning. So you can join the group, and then whenever you have a case study you want to hash out with other practitioners, there's your group right there with people who are on the same level with the same level of learning. You'll be provided practical resources for clients. So clinical handouts that you can utilize, and it'll be at the 50% of the standard cost of a unit at university. So you'll get registered access to use all my tools that have helped me be a successful practitioner in the bariatric space for close to 10 years. And in doing so, you will meet the needs of an ever-growing client base that needs you. So have a look at the details. Sign up. And if you get in before the early enrollment cutoff date and you live in Australia, you will get a hard copy of the practitioner text to use. So what are you waiting for?